Then, think it's too late to get varicose veins, scars, and stretch marks out of your life?
And there are a lot of things that people can do, whether it's a year after having a baby or it's 20 years later.
How you can make your body's worst enemies literally disappear.
It's like an eraser. It's the coolest thing ever.
Moms, what happened to your body after having kids?
90% of women have stretch marks.
Don't get mad, get even. And get rid of veins, scars, and stretch marks for good.
Oh, you're gonna love it.
Plastic surgeon team and dermatologist team. This is Dr. Elie and Jody Levine. They also happen to be husband and wife, incidentally, which is very cool. And we're talking today about women's bodies after babies. Now, we all know that C-section scars can be a huge issue for women, correct? Yeah, so that's what we're going to tackle next, right?
I can be sitting on the subway and talking to someone about what I do, and they're going to lift up their shirt and say, hey, take a look at my belly. What do you think about this?
Yeah.
Because it's the most common thing that bothers women.
It's the number one thing, right?
Almost 1 in 3 babies are delivered by C-section today, and the numbers are not going down. And it's understandable why these scars are not always healing that well, because sometimes they're done emergently, and the focus is always on the baby, and it's after the baby's out, it's like, let's close things up and move on.
Right.
So we have a few pictures that show what these scars look like. They can be...
We have 3 pictures of them, I think. Oh,
right, so
God, that looks
if you're
really painful.
That's a keloid scar, and it's thickened, it's raised, it's painful, and that can happen in African American women, Hispanic, Asian, Scandinavian backgrounds. This is another example of it, and she has a little bit of extra skin above it. And then the third example we have is someone who has an up and down scar running from the belly button down to the pubic area, which was the old way of doing C-section. So women that are in their 40s and 50s are still walking around with a lot of scars like this because this is the way they did the operation, and they still do it today when they do it emergently. And it's terribly unattractive, and while there are things to be done to address it now, the best way to treat these scars is to prevent them from looking like this in the first place.
It's absolutely amazing. So let's go over to the medical chair here, right? We're going to meet up with Lisa over here.
So my patients could probably come up here and do this as well as I could. I tell them about the 3 M's and the 2 S's. The first line treatment.
Well, first of all, let's catch up with Lisa here. Lisa, what's going on? Which of these scar situations is akin to you?
I have a cesarean scar.
Yeah.
I had 2 children. My daughter's 6, my son is 3, and both one scar after the other made it very difficult for the scar to go away from cream or anything. And right now, it just is, it's annoying.
Were both births C-sections?
Yes.
Oh, that's rough on your body, right?
Yes, multiple C-sections definitely make the scars worse.
So you were saying something about 3?
Yes. So the 3 M's are the first line treatment. Massaging the scar, moisturizing the scar, and mashing down on the scar. And if we can take a look, we can demonstrate a little bit of what these treatments are. So massaging the scar, mechanical pressure to a scar helps it heal better. And the best way to do it is with some sort of petroleum-based agent, whether it's Vaseline or Mederma or Aquaphor. It doesn't really matter which one, but mostly it's to prevent it from chafing. And I have patients start this about 2 weeks after they have any kind of scar, and they do it 3 times a day. And it's really pretty aggressive massage because the objective is really to break up the scar tissue.
So that's the first M.
The second M is moisturizing. Scars heal better when they're getting moisturized. And it's not just true of the scar. It can be the whole belly after having a baby. There are a lot of different products out there. We're using Eucerin today, but any number of them work. They're all over the counter, inexpensive, easy to get.
I'm a big believer in moisturizing your face, so why not any area of your body that you're having trouble with?
Absolutely.
I always tell people, going back to our stretch marks, I compare the skin to a rubber band. If you want to stretch a rubber band and it's old and dry, it's going to break.
It'll break, exactly.
Yep, but the skin, if you moisturize it, you can prevent those stretch marks in the first place.
And it becomes much more supple, much more elastic. What's the third M?
The third M is mashing, putting pressure on the scar. Not only the scar.
Keeping it all together there.
Yes.
So like literally a truss or a Spanx.
Spanx is great.
I mean, honestly, could we sing the praises of this company more?
For sure.
Yeah.
I mean, everything from fashion to medicine, the Spanx is where it's at. You're keeping it all together and taking the pressure off the scar tissue.
So it helps tighten and press on the scar, which helps it heal better. And it also, on the entire skin area, it encourages it to tighten down so you don't have a lot of extra skin afterwards. So it's great.
Thing, those
Absolutely
They're
great.
fantastic. Yep. Been using them since my babies.
I know, right?
Still using them.
So the second line of treatment are the 2 S's, which is silicone and steroid shots. Now, steroid shots are more after a scar gets worse, and that's done typically covered by insurance companies, is done by either a dermatologist or a plastic surgeon. But something that you can do at home that's very easy is silicone. Silicone sheeting or silicone gel, they both work wonderfully. We don't really fully know why it even works, but it definitely helps scars heal better. You literally put it on the scar.
You can buy this in the drugstore.
You can buy it in
just
the
go in and
drugstore,
ask
you can
for
get it on the internet.
silicone sheeting.
Yes, and it comes in all different sizes and shapes, and you can trim just a little piece that you need just for the area that you want.
Can I feel it?
Yeah, it's like jelly.
It's nice and cool.
Yeah, it's like jelly-like.
Yeah.
And the more you wear it, the better. If you wear 2 hours a day, great. If you wear 24 hours a day, even better. It's reusable. You put it right over the scar. You can, pull your clothing up over it, and it helps flatten out the scar.
That silicone stuff is great. Doesn't it feel nice and cool?
Yeah, it does.
Feels great. Okay, so thank you so much, Lacey. So let's move along over here, guys. What are we going to do with this next thing?
Well,
Dr. Jody, you're going to talk about unusual skin changes now,
Yes, yes. A lot of the changes that you get go away.
Come on over, you're the doctors.
Well, I brought some pictures.
Hi, I'm Rachel, by the way.
Hi, I'm Lisa.
You're in a precarious position, aren't you?
I am.
Well, bless your heart. Thanks for stretching out for us.
It's a good sport.
Okie doke. So
I was going to tell you a lot of the changes that we see in pregnancy to the skin do go away. That's good. But there are some things that are there to stay. A lot of the vascular lesions made up of blood vessels are actually going to stick around. I brought some pictures.
Okay.
That there is a cherry angioma, like a cherry red.
Cherry angioma.
Yes.
That sounds not good. Is that a bad thing?
Completely safe.
It's benign.
Benign,
Okay.
harmless, but sometimes it doesn't look that pretty.
Okay.
That is a spider angioma. It has a blood vessel in the middle and then other blood vessels radiating out.
That sounds really horrible.
Yeah, like a spider web. Also,
a spider and an oma in the same thing.
And then here we have some telangiectasia, just thin blood vessels under the surface of the skin. All of these can be gotten rid of easily with 1, maybe 2 laser treatments.
Really?
Very easy to treat.
Who knew the lasers was such a good buddy? So, a little laser treatment, boom, it's gone. Now, varicose veins is what we're going to talk about specifically
Yes.
on Lisa's body, right?
Lisa has some varicose veins, which she says she always wears these short tennis skirts, and you see her varicose veins, but she never had time to really address them.
Right.
So today we are going to. I'm going to
And
use,
how do you go about doing that?
going to use a procedure called sclerotherapy.
Sclerotherapy.
Sclerotherapy is the gold standard.
That sounds fun.
for varicose veins. You basically use a sclerosant, a solution that's going to close off the blood vessel and make it fade from view. So I use something.
Make it fade from view.
You no longer see it.
And how long does that take?
The actual procedure, I usually make appointments in 15-minute blocks.
That's it?
In 15 minutes, I can do both legs. A ton
Really?
of vessels, yes.
And how long before you see the vein disappear?
So as soon as I inject it, the vein disappears. But then the blood reperfuses, it comes back. And I often tell people, don't even look at your legs for the next 2 to 4 weeks because it will be a little bit bruised. But then in 4 weeks, even 6 weeks, the vessels are gone.
Unbelievable. But when you very first do it, it's like watching the veins disappear, right?
It's pretty cool.
So let's see it.
Down I go.
Down you go. Oh, this is exciting, huh?
Okay, so first I'm going to clean the skin. It's a little alcohol.
Cleanliness is next to godliness and the getting rid of veins.
My mom always says that. Okay, and now we're just going to choose some of her telangiectasias.
Telangiectasias.
Right here, I'm going to go to more of the superficial veins. And a little pinch, and
Oh my God!
goodbye.
It's like an eraser. It's the coolest thing ever.
Right? Right there, right there. And then we put some compression.
Unbelievable. It just went bloop, like on a thermometer. When you see it go up, it just went boop, went away. Just went away. Oh, you're gonna love it.
I also brought a video of some
let's see.
sclerotherapy that I did yesterday. So we can really see the blood vessels just disappear.
Watch this, you guys. Look at that. Isn't that amazing? I mean, wow, wow, wow. Unbelievable. Thank you to both of our good doctors, Doctors Jody and Elie Levine from the Plastic Surgery and Dermatology of New York City. For more information on all of these procedures, we've got everything there for you up on our website. Thank you so much to our ladies, too, who let us play guinea pig on them. Grab a snack, we'll be right back.